Thank you. I sincerely apologize for not being able to be there in person. So I am right here in Flint, Michigan, and as you know, we're still in the middle of our ongoing water crisis. So the water that I get from my tap right now is still not safe to drink, and it's hard to believe we are in our third year, over 1,000 days, where our water is not safe. And for 18 months of that time, the people of Flint were told that their water was safe. They were actually told to relax, that everything was okay, while it had bacteria contamination and disinfectant byproduct contamination, which is a carcinogen, and then now we know it had widespread lead contamination as well. So at least now the public knows their water is not safe. But we are very much still in the middle of this crisis, which is why I can't be there today. But I want to share. I want to, of course, thank everybody, and it's an honor to receive this award. But I also want to share all the awesome things that are happening in Flint. So we are now. I'm fortunate to spend my every day really turning the story around. Flint is very much now kind of synonymous as disaster. When people say Flint, it means disaster. So we are investing in Flint. We're investing in our kids especially. We can't take away what happened in Flint. Lead is an irreversible neurotoxin. We've known what lead does for centuries. It's probably one of the most well-studied neurotoxins. It impacts children's behavior, cognition. It's probably, it's a no-brainer in the pediatric public health world. It's an environmental injustice. It already impacts our most disadvantaged children. And it's an added toxic stress to so many toxic stresses our kids face. We have a 60% poverty rate in Flint. We have one of the highest violent crime rates in the country. We have no grocery stores. Our schools are crumbling. So our kids were already rattled with so many disparities. And then we have this added lead exposure. So I get to spend my everyday flipping the story around and really using this tragedy as an occasion to bring the community together and to invest in children and to invest in a culture of health. So now we have amazing things in Flint. For example, we have universal preschool, we have an early literacy program, we have nutrition access, we give nutrition prescriptions, we have Medicaid expansion, we have a new early child care center that just opened. We have a community that is engaged in their health and in the future of their children. So we're very excited about that, and we're also really excited that we've been able to elevate the issue of lead. Before Flint, people really had forgotten about lead. Physicians, we forgot about lead. We thought we took care of lead. We got lead out of paint. We got lead out of gasoline. But lead is a gift that keeps on giving. It's hard to get rid of. And there's many communities, and there's children all over that are burdened by this neurotoxin. And because of Flint, we're talking about water quality, and we're talking about infrastructure, and we're talking about investing in public health and not being reactive and being more proactive. We're talking about health and all. We're talking about children and all. So there's been some great ripple effects from what has happened in Flint. And for all those young people out there, especially those of you who want to go into medicine, I think the story of Flint really reiterates why a lot of us went into medicine and public health. We were all called to serve. We all wanted to go into we all wanted to make a difference, in people's lives. That's why I went into medicine. I thought it was the most intimate way of giving back, of serving. But we in medical education and in medicine do a really good job beating that out of people. So people get jaded throughout their careers, and they focus on reimbursement and ICD-10 and how many patients I can see, and we lose really the value of our profession. So I encourage all of you to stay altruistic, to use your voices, and to serve your communities, because there are very much Flints everywhere. There are communities where there are children that have lost their voices, that are suffering from incredible injustices, be it poverty or other kind of environmental exposures, that really need the credible voice of scientists. And I think this message is more important now than it ever was, because science is under attack from immunizations, from climate change. So science is definitely, we're in an era where science is being attacked, so we need great science. We are also in an era where regulations and public health agencies are being under attack. We need strong EPAs. We need strong CDC. If we don't, we'll see a lot more Flint. And then we also are in an era where healthcare is being attacked. We are at risk of 20 million people losing their health insurance. So it is necessary for all of us who are in medicine, who are in public health, to elevate our voices, to get out of our ivory towers, to get out of our labs, and to very much use our voices to make a difference in our communities. And it's uncomfortable and it's scary. And I can tell you, I was scared when I raised my voice and I was being attacked. But it is necessary, I think, now more than ever. So thank you for having me. This is an incredible honor to receive this recognition. I wish I could be there with you. But thank you for listening, and I look forward to absolutely connecting in the future. And as I look out and see all these young, beautiful people in the audience, I am so hopeful and I'm so inspired that there's going to be many, many, many more heroes out there in the future. Thank you.
Doctor, we're so grateful for everything. We're so grateful for your voice, your actions. I know that when we first talked, you talked about your work at Children's Hospital in Detroit, which resonates with many people here in this audience, and they are watching us as well in Detroit, Michigan. But your compassion clearly drives you. It's that kind of compassion that started Less Cancer, and I think the fact that you have been out there doing what you've done. You are a hero to all of us, and we're just
my job.
Yeah, I know. No, you're doing more than your job, and we all know. Many of us in the room know what it's like to get attacked. To say, wait a minute, I think something's amiss. We know what that response feels like. We understand that there are lots of nights we don't go to sleep. Anyway. We just wanted to thank you. Can you take a quick question from anybody? Okay, great. Does anybody have a quick, Miles, do you have a question? Or Susie, anybody out here have a quick question? Anybody? Okay, I have Veronique Pittman here. Do you want to stand up a sec? This is Less Cancer Board member Veronique Pittman.
Awesome.
Hi, congratulations. I just have a question about what the EPA could have done better in this situation.
So if you want to read more about what the EPA could have done better, the EPA Inspector General did an investigation, and that report is out. And basically it said that the EPA could have acted 7 months sooner. So they knew that there was lead in water in Flint, and they didn't alert the public. They didn't step in. They were really hoping that the state would have done more and didn't. The EPA had an incredible scientist named Miguel Del Toro who offered to use his own money to do water sampling in Flint, who wrote this amazing memo that was hidden. It was eventually leaked by this investigative reporter. But he was silenced at the EPA. So the EPA knew about it. They could have done more, and that is what was articulated by their Inspector General. But the blame is at every level of government, and I really don't want to focus on the blame, but predominantly the biggest blame is at the Michigan Department of Environmental Quality's Office of Drinking Water. They're the ones that were supposed to add the corrosion control, which was the missing ingredient in the water treatment that would have prevented this from happening in the first place. They were told by the EPA they needed to add it. They didn't add it. So they are the main culprits, but there was errors made at every level of government. Because of Flint, something that did pass Congress is an EPA notification bill, so that when the EPA knows that there's a lead and water problem anywhere in the country, now they have to share that with the public.
I think Dr. Sherman, our chairman, had one quick question. Doctor, if you can come up here. I don't understand where cameras are or anything. Okay, there we go. Here.
Thank you so much.
Tom.
You're
Go over here to the computer.
okay. Sorry.
Here's the.
There you go. There's the camera.
Thank you so much. It's an honor to be talking with you. I just was wondering if, very briefly, can you talk a little bit about the outcomes once the lead exposure has occurred? What happens to the children? What do you do to actually try to eradicate it? Is there any chelation, or is there anything that you can do? And then what is, I know this is a lot, you could probably talk for 2 hours about this, but just sort of briefly, because I think the kids probably share my concern. What happens to those children after they've been exposed?
Thanks.
Yeah.
Thank
so
you, doctor.
Lead is a potent irreversible neurotoxin. It impacts cognitive behavior, so it impacts how children think, how they act. It's been associated with conduct disorders. It's even been linked to criminality. Many people think that New York City's drop in crime rate was because of Giuliani's great work, but many scientists have traced it back to eliminating lead exposure 20 years prior. So it has these life course trajectory altering consequences. We worry most about children because that's when their development is happening, but it impacts the entire life spectrum. With adults, it's been associated with early dementia, kidney problems, hypertension. It also impacts pets. I've been at town hall meetings and people are like, you know, my pet got sick and my dog died. Why do you only talk about kids? I'm like, I'm so sorry, everybody was impacted. But the children under 6 who are most developmentally vulnerable are the ones that we really focus on the most. You can't take lead away. Once it is in your bloodstream, it has caused that neurotoxicity. It has a short window of detection in your blood, but then it stays in your bones for decades. And in periods of stress or poor nutrition or pregnancy, it can come back out of your bones and cause neurotoxicity all over again. And that's for decades to come. So chelation work is recommended for very high levels of lead exposure. However, the evidence on chelation is it may decrease your blood lead value, but it does not change the neurotoxicity impact. It does not change a child's cognition or behavior impact. It's also controversial because in chelation, it draws the lead out of your bones and back into your bloodstream to cause that neurotoxicity all over again. So there is no treatment for lead. The treatment is prevention. In public health for lead, you're supposed to do something called primary prevention, where you're never supposed to be exposed to lead because there's not much you can do. So, this is all based on large-scale epidemiologic studies. You can't tell like one kid, your lead level is this, you're going to have this problem. And in Flint, very much we are providing a lot of reassurance, we are providing a lot of hope, and we are providing all the resources for mitigation. You can't cure it, but you can mitigate it. And that's what we're surrounding our kids with. With robust, nutrient-rich environments from early education, great nutrition, healthcare access, developmental screening, to mitigate the impact of this. And once a delay is detected, to really have robust intervention early. And we have recently been funded to develop a registry. So we will be tracking these children over time for the next 20 years or so, but not to tell you what lead does, because we know what lead does. The goal of our registry is to tell you how we were able to positively and proactively intervene and to mitigate the impact of the lead exposure. Because if we do nothing, 5, 10, 15 years, we'll see the consequences in learning disabilities and special education and criminal justice and all these problems. So we're really hoping to share in this very data-driven way how we're able to proactively intervene, and that's what we're doing now in Flint.